technical difficulties, and you won't get to see my beautiful picture or Brenda's beautiful picture that she shared with us. But I just wanted to introduce Brenda. She is an international board-certified lactation consultant, and she's the founding member and past president of the Kansas Breastfeeding Coalition, Inc., known as the KBC. She currently serves on the board of directors of the United States Breastfeeding Committee and is the chair of their Advocacy and Public Policy Committee. Brenda is also the USCC representative for both the Lacey League and is based in the Mountain Plains region. I can tell you she's a very busy person. I know from firsthand experience that Brenda has both a passion and a talent for the work that she does in breastfeeding, bringing people together to remove barriers to breastfeeding. Her work is primarily focused around local breastfeeding coalitions, helping them to create a culture of breastfeeding support in their community. I'm a self-confessed groupie of the work that Brenda does in her state and community. I'm always looking for an opportunity where I can learn from what she does. And she's a very generous collaborator, and I can tell you that Indiana has benefited greatly from her willingness to share her ideas with us. I look forward to hearing Brenda share some of her work with us today, and I'm very grateful that she agreed to join us and also to deal with our technical difficulties. So take it away, Brenda.
Okay, thank you. Thank you, Tina, for that very kind introduction. That was very nice of you. And yes, we have to be flexible, don't we, in this line of work. We know how to roll with things. So thank you for those of you on the webinar for being flexible. And I'm surprised to hear Tina say that she is a groupie of mine, because I am a longtime student of Tina's. And actually, much of the work that we're going to be talking about today got started when Tina came to our state in November of 2012 and helped us to launch one of our programs about building and sustaining local breastfeeding coalitions. So I feel like a little sister to Tina. I mean, she has just been a great mentor to me. So I am going to get started telling you a little bit about our story. I really do view this as a story. It's a journey we're still on, and I really would like for you to jot down notes if you have ideas on how to make this work better. I would love to hear from you, so please feel free to share ideas and suggestions. We all learn from each other, and I fully intend to share anything that you see that you might need. We're here to share with you that, so let's work together on this. So I wanted to give you an idea of how we got started here in Kansas with our journey, what got us thinking, in other words. We started, when I say we, there's a group on our board that has been founding members and many of the current board members. We got to talking about, well, what would a breastfeeding utopia look like? You know, a perfect world, this mythical community where breastfeeding was just the norm and it was easy for everybody. And what would that look like? Well, it would look like a baby getting off to a good start in the hospital, probably. Having fathers involved from the very beginning, good maternity care practices, easy returning to work, support where you needed it, when you needed it, from the right person with the right level of experience, and children growing up knowing that breastfeeding is the norm. So this was kind of the picture that we were painting of what a breastfeeding utopia would look like. And then we had the Surgeon General come along and help us out with giving us some framework for this. Every year, as I'm sure many states do, we look at our national breastfeeding rates. This year, the CDC didn't issue a breastfeeding report card, but they did share the data on their breastfeeding website. And so we looked at that just last week, and we're thrilled to see that for the first time ever, Kansas breastfeeding rates increased in all measures across the board, which is just amazing. And in some instances, they increased by double digits. And we're especially proud of the exclusive breastfeeding rates at 6 months, which you'll see here on our graph are at 24.5%. When we were measured, and back with the 2011 National Immunization Survey data, that was 11.5, a huge jump in that number. And we moved from 48th in the nation in 2011 to 14th in the nation when you look at that one indicator. So we were really pleased to see that growth. But frankly, we don't know quite what happened in 2012, but it was just the beginning of some of this work. So we're really interested in following these numbers, and we're really proud of the fact that for the first time ever, Kansas is above the national average in almost in all the indicators. So that's something that we're excited about because we haven't been able to say that for quite some time. So back to the Surgeon General's. Many of you, almost everybody I know, is familiar with her call to action to support breastfeeding. But what we specifically were looking at were the barriers to breastfeeding. I think many of you will agree when I say that we really don't need to focus quite all of our resources and efforts on raising awareness about the benefits of breastfeeding or the importance of breastfeed. I think that in our country, the vast majority of people understand that breast is in fact the best way to feed a baby. But yet there are barriers to breastfeeding. So we've shifted our focus, as many have across the country, instead looking at what are the barriers for sustaining breastfeeding. 84% of women in Kansas start breastfeeding, and yet only a quarter of them continue to 6 months. So what's happening? Well, the Surgeon General gave us some really big ideas on what's happening. The simple lack of knowledge. Mothers' lack of knowledge around breastfeeding. We've missed several generations of generational knowledge passed on from one generation to the next. We have, as you all know, healthcare providers with a lack of information from their schooling about this. So mothers are left to kind of cobble together their resources, and some are fortunate to find excellent resources, while others are left to some that perhaps don't have some of the latest information. We also have a cultural norm that equates bottles with babies. As you all know, you walk down the card aisle to get a baby shower card, and I challenge you to find one that doesn't have a baby bottle on it. And of course, we're a country that sexualizes breasts and has a great love of formula marketing. There's a big connection between industry, as I'm sure you all know. None of this is going to be new to you, but I just wanted to set the stage for what got us thinking and where we went next with this. We know that there's poor or lacking family or social support, especially from the key roles of grandmothers and fathers. And the influence that they have over breastfeeding decisions to even begin or how long a mother continues to breastfeed. So this is another barrier that's been very well documented. And of course, embarrassment. Mothers out in public being told to cover up or go to the bathroom. And then, of course, this famous picture that was on Facebook of a young woman who was really chastised in social media for posting this particular picture. Just all of this underscores the fact that women are uncomfortable, and perhaps rightly so in some situations, about breastfeeding in public. And this goes back to the idea that we're not quite there yet in terms of a culture of breastfeeding support. And of course, the one that we're all very familiar with is returning to work and the support of child care providers when mothers are separated from their babies. And so this is a huge barrier for the vast majority of women who do return to work when their child is under a year of age. And this, again, is very well documented, so nothing here is new. But what got us thinking is that many coalitions or communities had addressed one or more or several of these barriers. But we got to thinking back to that idea of a utopia. Remember the definition of what if everything were perfect in a community, if all the pieces were in place? What would happen then? So we got to thinking about weaving a net of support for mothers in a community. Some might call it building a culture of support, but I like the weaving a net because I think for some mothers, having a breastfeeding support group like La Leche League can be a real lifeline to help her continue to breastfeed. For other mothers, her experience in the hospital will be a lifeline of support. But what happens when we weave all of those lifelines together in one community and see what happens? So this was a bit of an experiment for us, and we got to thinking, let's try to create a community and watch and see what happens when they have lots of pieces in place. Some will say a multifaceted approach to breastfeeding support. So we came up with this term, communities supporting breastfeeding. with 6 specific components to it that try to address those 6 barriers that the Surgeon General outlined in the call to action, all addressed at providing support to breastfeeding and sustaining it, so that we can help mothers, those 84% who get started, to continue. So we created a designation. The Kansas Breastfeeding Coalition created a designation called Communities Supporting Breastfeeding based on those 6 areas or components. And these criteria were very measurable so that a local community could easily measure their status towards this designation. They're very defined. So I'm going to step through what the designations are and the criteria is for the designation. And then I'm going to begin to talk a bit more about what this meant to local coalitions and communities across our state. And just to give you an idea of the timeline here, this was launched last fall. So we're nearing the first anniversary of when the Communities Supporting Breastfeeding was launched in September of last year. So we've been doing this for 1 year. So here are the 6 criteria. The community, and the community in this sense is usually a city. We have to, and you'll see in a moment why we had to define the geographic boundaries of the community. But the city has to have a local breastfeeding coalition. We all know the importance of that key group of people that are basically the stewards for the breastfeeding support in that community. We also recognize the importance of peer breastfeeding support, similar to La Leche League if it exists there, or some other mother-to-mother peer support that can be modeled. It doesn't have to necessarily be La Leche League, and we have several different examples across our state of peer support, but we recognize the importance and the value of that. So a community would have to have this. The third criteria is addressing maternity care practices, recognizing that one or more of the hospitals in the community has to be participating in a maternity care improvement program. And in Kansas, we have one called High Five for Mom and Baby. And I'm going to go into that in a bit more detail in a moment. Or they could be involved in Baby Friendly as well. But this one criteria is a measure of the maternity care practices in that community. The fourth criteria is addressing the embarrassment issue or the societal support, and that is having a defined number of businesses, 1 for every 1,000 community citizens, or 25, whichever is lesser, enrolled in or participating in our Breastfeeding Welcome Here program. And again, I'll talk in a moment about what that program entails. But this is a program that acknowledges businesses can self-acknowledge that they support public breastfeeding. The 5th criteria is about the return to work piece. We have an award that we give businesses called Breastfeeding Employee Support Award, and there's a measure of 1 business for every 5,000 citizens having received that award as a measure of the support from employers in that particular community. And the last criteria, but by no means the least, is the child care providers, having a minimum of 20 providers in the community that have completed the KBC's course, How to Support the Breastfeeding Mother and Family. And I have to say that this is how Tina and I really started working together, because Indiana Perinatal Network and Tina were very generous in providing the curriculum for that course and allowing us to run with that here in Kansas. And I'm going to talk a little bit more about what we've done with that in Kansas, but it all got started thanks to Tina and her generosity with IPN. And I have to say that all of this is being funded by our state health department, specifically through Title V funding through the Bureau of Family Health. And this was based on a relationship that we have built with them over time, and we took to them this idea of a designation. And they really saw the benefit of their local agencies, their local health departments being a part of this designation process, many of which were already involved in their local coalitions. And so this would be an extension of their work. So I think that it's really great that our state health department, the Bureau of Family Health, saw the value of this designation and what it could mean to a community. So what they did is they provided us with funding last fall to work with 6 pilot communities in our state to achieve this designation by July 1st of this year. And so I'm going to talk a bit about that journey then with those particular communities and what that looked like. So the first thing we did is we went to the communities and we talked about leadership. And we already have an existing program called Building Local Breastfeeding Coalitions. And this is, again, where Tina helped us. She came to our very first state breastfeeding coalitions conference, which I'm now happy to say we're hosting our third conference in October. So this is an ongoing support for local coalitions to come together once a year and share strategies that are working, to learn from each other, and to also bring in a national expert to give us some ideas on how to grow and strengthen. And we have individuals come from around the state that are interested in starting their own coalitions. And I'm proud to say that in Kansas, when Tina first came in 2012, we had 8 coalitions in our state, and we are now at 22, and 2 of them, as you can see, are large regional coalitions, and they both formed just within the last 4 months. So we're really excited to support this work out in the western part of our state, where they're coming together and forming these geographic coalitions. The rest of them are still on the county level. But we went to these 6 pilot communities and made sure that they did have, in fact, a coalition and to help strengthen them. And part of our support with these pilot communities is we went in and held a launch meeting where I came in and we had breakfast or lunch together with the coalition, and we invited moms, we invited child care providers, basically anybody who wanted to sit around the table and have a conversation about breastfeeding and what it looked like in their particular community. Because as you all know, the local coalitions know their communities best. And as I traveled around the state, like Tina does, I find that in one community, perhaps the hospital is just doing fantastic. And what they're really lacking is maybe community awareness around public breastfeeding. And so that was the area to work on. So these launch meetings that we did with each of the coalitions gave them a chance to have a conversation and really get a sense of the landscape of breastfeeding in their community, what things were working well, and what things they might need to address in order to achieve this new designation. And we do have quarterly conference calls also with them that helps to support their work. And we connect these 6 pilot communities so that they could learn from each other as well, also during conference calls. So that was another benefit during this process. The next piece of the 6 criteria is the peer support. And in many of these communities, the 6 pilot communities, there already existed a La Leche League. So that was really easy to check that one off for 5 of the 6. But in the 6th community, they are starting a breastfeeding support group from scratch. And we, KDHE, our state health department, provided funding for the Kansas Breastfeeding Coalition to record a 1-hour training, how to start a breastfeeding support group. And this is available for free online to anyone through Kansas Train, and there's the course number. And I believe it's available across the nation now. And it's a simple 1-hour, how would you start a breastfeeding support group? How do you choose a facilitator? How do you manage discussion? Where do you pick a location? How do you pick a time? And so it tries to help you to think through all of those components of starting a breastfeeding support group. And then, of course, we know the WIC peer counselors were also key in these communities because many of them also provide breastfeeding support groups or, of course, the individual support as well. So peer support is pretty strong in Kansas, but in many communities, they're starting from scratch. So we do have this resource for them as well. And then we have maternity care. This is our 4th criteria for the designation. How well is the hospital caring for moms and babies so that they leave the hospital breastfeeding? Well, in Kansas, we're very fortunate that a private foundation, the United Methodist Health Ministry Fund, has funded a program called High Five for Mom and Baby. And this is a program where hospitals implement 5 maternity care practices, basically 5 of the 10 steps, and that are shown to evidence-based increase breastfeeding duration rates and exclusivity. It's modeled after the Colorado Can Do 5. Some of you may have are aware of other state programs that are 5 of the 10 steps. So this is basically what it is. This is not administered by our state health department, but is done through this private foundation. The majority of our hospitals, we have 71 hospitals. You can see 53 are involved and enrolled in the High Five program. 17 hospitals have achieved all 5 practices and have received the designation as a High Five for Mom and Baby Hospital. So one of our criteria for the community supporting breastfeeding designation is that the hospital has to have their hospital participating in this program. And just to give you an idea, here in Kansas, we have our first baby-friendly hospital just 2 months ago. So up until this time, we didn't have any hospitals that were accredited as a baby-friendly hospital. So High Five was the only game in town. But now I'm happy to say that our largest birthing hospital in Wichita is now a baby-friendly hospital. And we have 5 hospitals involved in the Empower project, which is the next cycle from the CDC of assisting hospitals to become accredited as baby-friendly or designated as baby-friendly hospitals. So that's about to change. But things are changing here in Kansas around maternity care, but the designation was written at a time when baby-friendly was just not on the radar with most of our hospitals. So I just wanted to point that out. That's why the designation specifies the High Five for Mom and Baby, because most hospitals were familiar with that and already involved in that. Okay, the next criteria was around societal support. That embarrassment component, we talked about moms feeling comfortable breastfeeding in public. This is a program that we already had existing a year ago, and it actually had been in existence for several years. And it's a decal that businesses can display by their front door saying that they welcome public breastfeeding, that breastfeeding mothers are welcome there. And this is a program, there are many, many across our country that have this type of system of a decal for businesses. Here in Kansas, we have almost 300 participating businesses. And in Kansas, we also have funding to provide these life-size cutouts for local coalitions who would like to go even another step to reduce the stigma around public breastfeeding. So our Breastfeeding Welcome Here program is the measure that we use for this criteria in our designation system. They have to have a minimum number of businesses enrolled and displaying this decal in their community. And we had to be, I just needed to explain a minute about this, we had to be kind of picky because we had one community who said, great, we can get 25 businesses, and they had all of the clinics in their hospital enroll. And the next thing we knew, we had like 10 new enrollees in this program, but they all had the same address because they were all housed within the hospital complex. And so we had to clarify that the intention, again, of this designation was to create a culture of support, that breastfeeding utopia. And while they had done that on the hospital complex, that hadn't actually filtered out into the community. So we do have a specification on this designation that in counting the businesses, they do have to have unique street addresses. So to get at that idea that we will have at least 25 businesses in the community that have displayed this decal so that parents and the public walk down the street, walk through the mall, and they see this frequently and they encounter this decal, again, to create that idea of a culture of support. So this was a program we already had going, and it was just creating this as a measure for the designation. The next piece, the 5th criteria, was around employers. We all know how critical this is. In Kansas, we've had the business case for breastfeeding for quite some time. In 2009, we were one of the original trainees from the federal agency that came in. We've since received private foundation funding to continue this program and expand it, and it will continue through 2017 as well. And it's allowed us to have a dedicated website. You'll see the address at the bottom of the slide. And what that is it's a website. You'll notice it's .com. It's designed specifically for businesses that really aren't interested in breastfeeding as a health aspect or as a cultural aspect, but simply as it affects them as employers. So the entire web site is designed for employers. It's modeled after the business case. The content comes from the business case, and it also has a lot of information about the current federal law, of course, so that employers understand how to be in compliance with that. With funding from the private foundation, we're able to go out and do presentations to employers. Of course, we give awards to employers, which for us in Kansas is a clock. We have a digital clock that has an embedded certificate in it behind a glass photo frame, and it has their level of award, bronze, silver, or gold level award, and that's the clock says the business or kansasbusinesscase.com, so they'll have that website as well. They get a press release along with this, which in many of our small rural communities, the local newspaper is always looking for something to run, and the businesses get a lot of positive press around this particular award. So having the award plus the press release has been a really good combination. We also have a return to work class outline, which comes straight from the business case for breastfeeding toolkit. And that's been very popular in health departments and hospitals that offer prenatal classes. And we've been able to do direct consulting with businesses. And one of the 6 communities actually had me come out, and we went around and met with 5 of their largest employers. And the local coalition set up the appointments ahead of time, and we have spent a day and a half just meeting with the HR people in these large employers. And it was myself and a member of the local coalition. And by the time we got done with the first 4 or 5 appointments, she said, you know, this is the best training I have ever had. And she had been through a business case for breastfeeding training. But there's nothing like sitting down across from an HR person to really understand how to speak their language. So that direct meeting with businesses is something that we've been able to provide because of the funding that we have that funds my time to go out and do that. So in these communities that are trying to achieve this new designation, they can lean very heavily on us for support in this particular component because they know that they can call me and say, you know, I want to work with an employer so they can achieve the gold level award. Or I've got a business who's at the bronze level, but they really want to be gold. What do we need to do to get them there? So we've been able to really help strengthen employers' support beyond just the basics that the law requires. So that's been something I think that's been a great success from this designation process. And the last criteria, as I said, is around child care providers because we really realize their important role in sustaining breastfeeding. As Tina knows, and many of you in Indiana know, that the importance of child care providers supporting the breastfeeding family is critical to breastfeeding success. They can have the most supportive employer and the lactation room at work, but if the child care provider doesn't value that milk or doesn't understand growth spurts or how a breastfed baby eats, oftentimes that milk can be wasted. Or a mother can be left, can be told, oh, you need to bring more milk in because your child is eating so much, when in fact the child is maybe being overfed. So this child care provider education program, thanks again to the IPN, has been pivotal, and I'm proud to say we've trained almost 1,200 providers. That number of 1,166 was as of last month, and we have 64 providers that are going through the training this month. We provide this training in partnership with the online opportunity through Kansas Child Care Training Opportunities. And every month they handle the online registration, they host the online class, and they process the certificates for the students after they complete the course. What we provide, the Kansas Breastfeeding Coalition, is the course monitor, which up until a few months ago had been me. And so we're online with the students every month, reading their posts, interacting with them online as they're going through the curriculum. We've since hired a new person to handle that. But it's a fantastic partnership because we're providing the content, the curriculum, and the interaction with the students, and Kansas Child Care Training Opportunities is providing the infrastructure, the registration, and the processing of certificates. We also have a new partner, Child Care Aware of Kansas, and we're creating a designation for child care providers, both individual family-based providers as well as centers. And I'm proud to say we're having our first meeting this Friday to take a look at what that designation criteria will look like. There's so many across the country. I think it's going to be very easy to craft one for here in Kansas. But we want to make part of the criteria this education piece, that all of the providers in the center have been educated with this 2-hour training that has already been developed. So the designation system will go beyond just the 2-hour class and will recognize providers who have created a culture of support within their own program. So that is the sixth or the last criteria for the designation, communities supporting breastfeeding. So I just wanted to go back through what the KBC provided to these initial 6 communities that were selected to be the pilots, to be the very first to receive help. I should mention, I guess at this point, perhaps I should have earlier, that any community in Kansas can become a community supporting breastfeeding. Any community is eligible for this designation. And we have many across our state that are working on becoming a community supporting breastfeeding, even without the direct assistance from the Kansas Breastfeeding Coalition. And I think part of that is because we have many strong local breastfeeding coalitions already, and we have many of the 6 criteria are already aligned with some of our statewide programs where the resources already exist. So we have some cities that are very close to achieving the designation, and we haven't provided any direct technical assistance. But in these 6 pilot communities, and by the way, we selected them for their geographic diversity as well as the infrastructure that they already had on the ground. In other words, they had some of the criteria already met. So as I already mentioned, I went out and conducted a facilitation of the launch meeting. I called it the landscape of breastfeeding. We all got around the table and talked about what was working and what wasn't. And that was the beginning of their process. We did that last fall. And we continued with conference calls and, of course, email exchanges about how do we meet these designations, how do we work with businesses, how do we work with child care providers. And there was a lot of sharing between the 6 sites as well. When we would have our conference calls, there was one community that I would send out monthly status reports, and it was a big spreadsheet where every community could see each other's status. And so there was a bit of peer pressure, but it created interest because one month a community had gone from 5 businesses in the Breastfeeding Welcome Here program to 51. And oh my goodness, on the next call, everybody was like, what did you do? What did you do? How did you get that many? Well, what they did is they partnered with their local community college, and there was a class, and I'm forgetting what the name of the class was, where the instructor made it a part of a class project for the students to go out and enroll businesses in the Breastfeeding Welcome Here project. And it was a fantastic partnership between the community college and the coalition, raising the awareness of the students at the same time about the importance of supporting mothers in public. So these kinds of exchanges of strategies was, I think, a great outcome from those conference calls. Along the way, at about January or February of this year, we went out to all 6 communities and hosted what we call the Continuity of Breastfeeding Care Meeting. And this was a chance to gather everyone together again, anyone who cares for mothers and babies, to talk about how the community was doing in preparing mothers for their hospital experience, that high 5 for mom and baby experience, as well as the direct connection to resources when the moms and babies left. So those of you that are familiar with the 10 steps, we're talking about step 3, prenatal education, and also step 10 around the connection to community. And this is what we did in those 6 communities with fantastic outcomes. There was one meeting where we had a doctor in the room, and he was seeing the babies on day 7 to day 10. And when we started talking about what the standards were for seeing babies earlier, he said, oh, well, I can do that. And at the same time, we had the labor and delivery, the head of labor and delivery, the nurse director in that room. And she said, well, I'd be happy to call your office and schedule those appointments then. He said, well, great, let's do that. And so it was a fantastic, I think, outcome of a meeting. And there were many others like that where we improved continuity of care simply by getting everybody in the room together. And then what's happening right now is the celebrations. 5 of the 6 communities achieved the designation, and so they all received proclamations that were read at their city commission meetings, press releases that were published in their local newspapers, and of course we're hosting a party. They all get to pick how they want to have a party. Some are doing dinners or breakfasts or lunches around their coalitions. They are encouraged to invite the businesses and child care providers that help them to achieve this designation. One community has decided to forego the party and put that money towards an ad in the local newspaper where they can celebrate and announce the new designation for their community as a community supporting breastfeeding, and also list the individual businesses that participated in the Breastfeeding Welcome Here and employers who received the award for supporting their breastfeeding employees. So lots of creativity, and it's a very, very fun time to go to these communities and celebrate with them, because it was some work to make all those measures, specifically when it came to working with the businesses. I think that was probably the most challenging piece of this. And so here's a picture of the communities that have achieved the designation. And our very first, interestingly, Lawrence, Kansas, was not part of the 6 pilot communities that received direct assistance. They went off and did it on their own. This is a coalition that's been in existence for quite some time. They're highly functioning, very organized, and they made it a goal to be the very first CSB community in Kansas, and they in fact achieved it by 1 day. Ahead of Winfield, Kansas, then we had Great Bend, Salina, Liberal, and Hayes. And we have a 7th community that should be achieving that within the next 60 days as well. That was part of that initial 6 pilot communities. And I'm proud to say that we submitted a joint proposal with our health department to a private foundation, the Kansas Health Foundation, and they are supporting the expansion of the community supporting breastfeeding work into 10 additional communities over the next 2 years. So we're now designing an application process where communities can apply to receive the technical assistance that we provided these initial 6 pilot communities to achieve the designation. And that application will actually go out next week. We'll begin working with those communities in September so that they can, the first 5 will be selected this fall, and then the next 5 will be selected in fall of 2016. So we're very excited to be able to continue this designation. And I have to say that in talking with all of these communities afterwards and asking them what worked and what didn't, I think a common theme that I heard throughout from the local coalitions were, thank you. Thank you for coming out to us, for giving us the support, and above all, for giving us some project, some direction, some goal to work towards. Some of these coalitions, for example, Salina, have been around for a long time. They were one of the original 8. And they were meeting and they were talking and they had done some smaller projects. But this just breathed new life into their coalition to achieve this designation and be recognized across the state for what they're doing. So it was a combination of having support, but also the recognition for the hard work that they've been doing, frankly, for years all along. So this is something that I think the coalitions really enjoy. And as I said, many coalitions are working on the designation alone by themselves, with some support from us, but not being part of the pilot project. And we have a lot of coalitions interested in applying. So that is a bit about our journey. Here is my contact information. And as I said at the beginning, I really do want to hear from you. If there are people on the call, on the webinar, who have suggestions or ideas for how to make this better, stronger, and improve it, I would love to hear your ideas so we can incorporate those and strengthen this. And if there's anything that I have shared that you would like to implement in your communities, please feel free to reach out to me, and I'm happy to share with you anything that we've created or designed or any lessons learned along the way It's been a very pleasant journey, and we're looking forward to continuing this for a couple of more years and beyond, if possible. So that is the end of my presentation, and because we do not have Tina on the call, I'm not sure if I'm going to be able to see any questions.
I think, can you hear me?
Oh, yes.
Can you hear me?
Yes, I can hear you.
I went to another computer, and although the speakers aren't that good, I'm glad you can hear me. I am so appreciative of your work and inspiration, and I also have to say that you are a role model for what can happen in a state when the coalitions work with the health department, work with WIC, work with other entities in the community, and collaborate together to make real change happen. I know you and I both believe that great change happens through small conversations in the community among people who care. And I think this is a perfect example of that belief. And I also think that your examples show the layers that coalitions can bring into the community to create real change. And I think that even though we do not have a coordinated effort in Indiana or funding for that, I think that many of your ideas are really great for the people who are on the call that for their local community coalitions, and giving them ideas about either doing all 5 of the ideas or a couple of the ideas, but it doesn't take a lot to go and meet with the business and give them a designation. So I thank you for all of that inspiration.
Well, you're welcome. I think that
I
it's, like I said,
did not get any questions.
Oh, okay. Can you hear me? Can you still hear me, Tina? Okay, good. I was going to say that I think working with businesses was probably the most challenging piece for the coalitions because they're used to working within the healthcare sphere, you know, with hospitals and support groups, those kinds of things. That working with businesses really took some creativity, and I'd be happy to share strategies that those coalitions learned along the way. But I can tell you that it really they reaped rewards because the communities, the businesses now know these coalitions exist. And that really helped to raise the level of awareness in these communities around the Chamber of Commerce, among their, like I said, the community colleges, around, you know, that they're even there for breastfeeding support.
Yes, I would agree. It's sometimes hard to get people who wear a clinician hat and they're used to their environment, their medical setting, to take that leap of faith and go into the workplace. We've seen that in our state as well. I think that we're going to have to beg you to do a part 2 somewhere down the line, and continue to teach us about your style of doing work. We have a couple minutes left here. Again, if you have Brenda's contact information, and I know that she has always answered all of my questions that I've had. If you think of questions as you move forward with these ideas, I'm sorry that you're not getting to see my slides that I worked so hard on today. But one of the things that I wanted to remind everyone is about our annual Breastfeeding Coalition Summit. We're so excited about that's coming up on November 13th, and it will be at Methodist Hospital in downtown Indianapolis. This year's speaker is Dr. Gail Christopher, and if you read my newsletter, you know that she's another person I'm a groupie of, and she talks a lot about health equity and health disparity in breastfeeding. She is a must-see speaker in breastfeeding. I can tell you that the first time I saw her speak at USBC, she must have gotten 15 or 20 standing ovations. It's not often you see a breastfeeding speaker that gets standing ovations, and that's how impressive she is as a speaker. So I invite you to mark your calendar for November 13th. We'll have more details about this conference. I don't think I've been as excited about a conference as I am about this year's event. So we hope to see you all there. We thank you for your patience with our technical difficulties, and we also thank the WIC program for sponsoring this call in part, and also invite you to next month's call, which will be working with WIC Part 2. So a few months ago, WIC did a wonderful presentation, and then they're going to continue that conversation on September. Excuse me, I just skipped a month. It's September 15th. So thank you all for joining us, and thank you so much, Brenda, for sharing all of this information. Have a great afternoon.
Thank you for having me. It was an honor. Bye-bye.
Bye now.